Welcome to The Explainer. Today, we're diving right into the thyroid gland, demystifying what it does, and exploring how to safely manage the situation when it, well, totally goes into overdrive.
So let's kick things off with a fascinating question, one that literally affects every single cell in your body. What actually happens when your metabolism runs way too fast? Honestly, it's a state of pure physical chaos, and it's a daily reality for millions of people. We're going to unpack exactly why this happens, what it looks like, and the definitive surgical steps you can take to finally hit the brakes.
Here's our roadmap for today's explainer. We'll cover understanding the thyroid gland, hypothyroid versus hyperthyroid symptoms, the causes of hyperthyroidism, considering a thyroidectomy, preparing for surgery, and finally, recovery and lifelong management.
Let's jump into Section 1, Understanding the Thyroid Gland, the Body's Engine.
So, the thyroid gland. It's this small, butterfly-shaped powerhouse sitting right at the base of your neck, just below the Adam's apple. Think of it as your body's master metabolism engine. It produces these highly specific hormones that get secreted straight into your bloodstream and carried to, literally, every single tissue you have. I mean, this gland dictates how your body uses energy, how you maintain your body temperature, and it essentially sets the rhythm for your heart, your brain, and your muscles. Without it functioning correctly, the entire engine of your body just falls completely out of sync.
Moving on to Section 2, Hypothyroid versus Hyperthyroid symptoms, looking at the extremes.
You know, when we compare thyroid conditions, it's really helpful to look at the absolute extremes. Hypothyroidism, for instance, is a lot like driving with the emergency brake on. It completely slows you down, leading to heavy fatigue, feeling constantly cold, and this really frustrating unexplained weight gain. Hyperthyroidism, on the other hand, which is what we're focusing on today, is like pressing the gas pedal all the way to the floor while you're sitting in neutral. It just revs you up. You're dealing with insomnia, severe sensitivity to heat, rapid weight loss even when you're eating way more than usual, heart palpitations, and just this constant anxious trembling feeling. It is an incredibly exhausting state for your body to be stuck in.
Section 3, the causes of hyperthyroidism and why exactly it gets so overactive. According to the Mayo Clinic, Graves' disease is by far the most common culprit here. Now, Graves is an autoimmune disorder where your own immune system just sort of goes rogue and mistakenly attacks the thyroid, forcing it to overproduce those hormones. But it's not the only cause. You might also have overactive thyroid nodules. Sometimes doctors call these toxic adenomas, which are basically these small, non-cancerous lumps inside the gland that have decided to produce their own extra hormones. And finally, there's thyroiditis. That's an inflammation of the gland that actually causes stored-up thyroid hormones to leak directly into your bloodstream.
Now, this next point is absolutely crucial. If left untreated, this hyperactive state isn't just uncomfortable, it can be incredibly dangerous. It can escalate into a rare but literally life-threatening complication known as a thyrotoxic crisis, or a thyroid storm. This happens when the hyperthyroidism just completely overwhelms the body. We're talking sudden high fever, dangerously fast heartbeats, severe dehydration, and even delirium. It is a strict, no jokes about it medical emergency. And honestly, this is exactly why getting definitive treatment is so incredibly important.
All right, Section 4, Considering a Thyroidectomy, the Surgical Solution.
So, to help doctors and patients figure out exactly when surgery is the smartest path forward, we can look straight to the clinical guidelines from the American Thyroid Association.
Who should actually consider going under the knife? Well, a thyroidectomy is highly recommended for patients with Graves' disease who also suffer from moderate to severe eye issues, like bulging or pressure. Why? Because alternative treatments, like radioactive iodine, can actually make those eye symptoms significantly worse. It's also the preferred route for smokers for that exact same reason. Plus, women who are pregnant, nursing, or have young kids at home will often choose surgery to completely avoid exposing their families to the radiation used in other treatments. And of course, anyone dealing with an enlarged gland that causes a choking sensation or any nodules that look suspicious for cancer should definitely be booking a surgical consultation.
When we consider surgery, we always have to balance the scales, right? The benefits here are just massive. It offers a rapid, definitive cure to hyperthyroidism. You get to skip that prolonged transition period. It rapidly drops the antibody production that protects your eyes, and, huge bonus, it's completely radiation-free. But, as we know, no surgery is without risks. Because the thyroid sits so close to some vital structures, there's a very rare risk of transient, meaning temporary, injury to your vocal nerves, which could leave you a bit hoarse. There's also a risk of temporary low blood calcium. This happens because your parathyroid glands, which are these 4 tiny glands attached right to the back of the thyroid, just need a little time to wake up and recover after being handled during the operation.
Let's look at Section 5, Preparing for Surgery, a step-by-step guide.
The whole period right around your surgery follows a pretty strict timeline. About 10 days before the big day, your doctor might have you take non-radioactive iodine drops. You might be wondering, why do that? Well, it actually decreases blood flow to that overly active thyroid, which makes the surgeon's job a whole lot safer and cleaner. Then, on the actual morning of your surgery, you'll stop taking your regular anti-thyroid meds. And usually, the very next day, a brand new routine starts. You'll begin taking a daily thyroid hormone replacement pill simply because your body's natural hormone factory has just been removed.
During the actual procedure itself, which is of course done under general anesthesia, an experienced high-volume thyroid surgeon makes a small incision right in the front of your neck. Their main job is dual-focused. They need to carefully remove the overactive gland to cure the disease while rigorously protecting your vital vocal nerves and those tiny parathyroid glands we just talked about. After it's all done, you'll likely hang out overnight in the hospital just so they can monitor your calcium levels and make sure you're recovering perfectly smoothly.
And finally, Section 6, Recovery and Lifelong Management. Your immediate recovery over that first week is generally pretty manageable. You're probably going to have a sore throat from the breathing tube they use during anesthesia, so a soft diet, think soups and smoothies, is going to be your best friend. You're also going to feel way more fatigued than usual. I mean, your body is directing a massive amount of energy towards healing that surgical site. So giving yourself full permission to take plenty of restorative naps during that first week, absolutely essential.
But perhaps the absolute most important takeaway for your long-term health comes directly from the American Thyroid Association. Removing the thyroid means committing to taking a daily hormone replacement pill for the rest of your life. Since you no longer have the gland to naturally produce thyroxine, you've got to supply it externally. This ensures your body's metabolism can keep running smoothly, but this time at a normal, healthy pace. So I'm going to leave you with this final, pretty provocative thought. For those out there suffering from the exhausting, runaway train that is hyperthyroidism, are you prepared to trade the sheer chaos of the disease for a definitive, rapid surgical cure and a highly manageable, lifelong commitment to just one daily pill? It is a profound trade-off, but for so many people, it's the exact step they need to finally get their life and their energy back in balance. Thanks for hanging out with me for this explainer, and keep learning.